Hi everyone, it is me, Jeanette, and I am here to go over your Chapter 6 lecture. This is a really long slideshow, and again, remember that I try to make these a little bit more dense and text heavy for those of you who maybe weren't able to buy a textbook. But I'm not going to go over every single point on the slide. I'm going to kind of summarize for you. But this week and in this, we're starting a new module, and the module is going to cover social welfare and programs, and it's going to cover diversity. So this will kind of also give you an overview of different specialties or fields or areas you may want to work in. So ideally at the end of our module, you'll be able to understand how we define poverty and assess who might be living in poverty and really how well we're meeting the needs of those in poverty. You're going to be able to discuss the different social welfare programs that are established to address poverty and other clear needs to support a healthier society. And we're going to talk a little bit about some income inequality. I'm going to encourage you to do a little bit more research on your own about wealth inequality as well and the wealth gap. And then additionally, we'll talk about kind of some of the biases and perceptions and the political climate involved in assessing who's worthy, who's not, and how we direct public funds. And then I want you to be able to differentiate between eligibility and entitlement. And for this activity, I'm going to actually have you choose a program and dig into the application process and understanding the eligibility criteria associated with that. Okay, so as we dive into the content, we're going to be looking at social welfare programs. And by social welfare programs, we mean programs that are designed to provide services or goods or resources to individuals, and they're provided by government. So they're programs that are typically organized by government or private agencies or organizations to support people in need, so to support community well-being. Examples will include Social Security, public assistance, food stamps, WIC. We'll go over a number of different programs, but they're basically programs designed to meet people's basic needs. And in a country of such great wealth, it's interesting to see how politically it's so controversial, right? When in fact we're supposed to be the wealthiest nation in the world. So when we're talking about some of the U.S. programs, then it's important to note that we are often described as a reluctant welfare state. Going back to those core values we've talked about in terms of individualistic values, self-determination and autonomy and resilience, pull yourself up by the bootstraps. Those value systems and then the underlying commitment to capitalism and our pride in kind of individual wealth is really what contributes to us being a reluctant welfare state, that drives a sense of resistance. We create this moral judgment toward individuals who are in need and somehow judge their character in a disparaging way. And often circumstances that create needs are temporary and often created by things outside of our control. So it really isn't a reflection of character. I found myself in a difficult situation at times. I grew up in poverty. I grew up on welfare and food stamps and free lunch programs, and certainly it was of no, actions on my part. It just happened to be my parents were poor, but my dad also had some mental health challenges. So there were periods of time when he was unable to work, but he was a very hard worker. But during those gaps, my mom needed to put us on welfare. And I'm thankful for those resources. But that being said, it's a very complex, dynamic situation. We have very complex systems that are often very difficult to navigate. We have all this extra bureaucracy, and they prove to be barriers for individuals. You also have, because we value states' rights, right? You have different states and different agencies might do things different ways, but there are a number of different programs and resources available, but we make it very difficult to access those resources, and the process by which you apply and are eligible is different from program to program. I do want to talk about means tested because it comes up a lot in this chapter. When we're talking about a means tested program, we're talking about income eligibility criteria. We're talking about that being what is often referred to as an entitlement program. It's often stigmatized and it has a very negative viewpoint. And so the government imposes these restrictions to access these programs, but also to ensure the viability and sustainability of these programs long term. There's tax credits also that are another means, another strategy to get funds into the hands of families to help meet their basic needs. And so here's just a list of some of the major programs that are covered in this particular chapter. We'll go into depth on some of them, and others I'll leave for you to discover through the reading, and then others we'll discover through our learning activity this week. So let's talk about poverty, because poverty is really the foundational issue here that creates these needs and that helps us to recognize that basic needs are unmet in society. The formula that we established to assess poverty, to define poverty, was established in 1963. As you might imagine, economics are entirely different now, cost of living is entirely different now, and we're still basing a lot of our programs and our funding for these programs on very outdated data. So that therein already lies a problem, right? Additionally, when we're talking about, even looking in the 1960s, it was already problematic because you're talking about it being based on our minimum food diet, and there's more to basic needs than just food, right? And so housing costs weren't properly accounted for. Other expenses like childcare, transportation weren't properly accounted for. So it's always been below the mark, below what was necessary. It's forced individuals receiving these benefits to live in conditions that are really in poverty. It's almost perpetuating poverty rather than lifting people out of poverty. And it's even worse because we are now in modern times where we've had inflation and the costs of living are significantly higher. So it's problematic. The U.S. Census Bureau does track poverty. Again, it's based on old numbers and old concepts of poverty and definitions of poverty. But either way, we can see the income levels, and we also have to take into consideration geographic differences, right? Because the income that's sufficient to lead a wonderful life in one state may be very much, poverty lifestyle in another state. So there's also some added complexity we have to think about. So in terms of poverty guidelines, when you're talking about for family households, and this is the number of family in the households, here's the poverty guideline based on the current numbers that we utilize from 2018 in the U.S. This is horrific. There's no way, even for a family of 8 that I could live on, even for a family of 4, 42,000 here in California or in Hawaii, that's not a sustainable income. So there's a lot of conversation in media today about livable wages. Well, we don't even provide livable wages. We don't even have minimum wage that can support, that provides a livable wage. And we certainly don't provide livable benefits, right? So, here's some more of the criticisms. It's outdated. Food is not the primary expense in our budgets. Housing is actually now. And childcare, particularly for young children, families with young children, sometimes childcare can be more expensive than rent. And again, the geographic issues. We also have had some very kind of conservative definitions of family that have governed access to benefits. And we think of family in the 60s term as this nuclear family that was created through this misconception perpetuated from television. And in reality, our families in the U.S., particularly because we've been an agrarian society, and we had, disease and illness, and it was a very difficult life. So family structure has always varied from that, 2 parents, 2 children, a dog, and a white picket fence perception of family structure. So even people who have income over these poverty guidelines, they're still very much poor. They would still be in poverty by a layman's term. We certainly wouldn't want to see, we certainly wouldn't likely see anybody like Trump or the upper 1% wanting to switch places and live the lifestyles of these individuals. And so even with government assistance and even with these benefits, they're still very much living a substandard life in terms of the access to the resources that they have. HUD is a housing authority, and there is subsidized housing available. However, wait lists are long. Again, the eligibility criteria is challenging and complex and outdated. Additionally, they are not accounting for, a standard of living that's appropriate for that particular region. Although they do have varying target incomes based upon where you're trying to access housing, it really does need to be updated and modernized. And they do consider a varied income, higher income allowances are considered for larger families. So I think it's really important to note that last point where it was saying that even if you earn $1 over than the income limit, you're not eligible. And so those individuals can be unhoused because they can't afford housing. We really need to rethink programs that help to promote and reward people who are sharing in the cost, right? And so rather than saying they're not eligible for any benefit, maybe we could have graduated benefits where based on your income you're entitled to a subsidy, a certain dollar amount, and those dollar amounts increase depending upon your income level. So the self-sufficiency standard, this organization introduced this, and this model actually is suggesting that we actually build services that promote self-sufficiency, that will gradually allow them to transition to financial positions where they can be sustaining their own expenses and less dependent upon the resources and the benefits. It also is proposing that we do consider the whole needs of the individual, including childcare and transportation and housing, and that we look at, what is it actually going to, what's the actual cost of sustaining the family needs, and then based upon that, we can say, okay, here's a minimum budget goal, and there can be a cost sharing of sorts until they're gradually able to become more self-sufficient. This cliff effect happens when you do have an increase in income and then all of a sudden you lose benefits. You're pushed right over the edge. And so individuals are reluctant to try to advance themselves professionally, financially, because, they might make just a little bit more that now disqualifies them, but not enough to take care of the loss of that income. So again, that need for graduated benefits and self-sufficiency continues to be a common theme throughout this chapter and when analyzing the different programs. The supplemental poverty measure is an alternative view. This is looking at all of the different social welfare and income streams and resources. When we look at the overall amount of people that are receiving some sort of entitlement program, as they call it, Social Security, which I consider just a tax refund really for many individuals, earned income tax credits. Millions of individuals rely on these resources, but the supplemental poverty measure would allow them to take into consideration the geographic adjustments that are needed for the difference in housing expenses and cost of living. And it might see that the poverty rate and figures are different in more expensive states and in less rural states. So when we talk about who is poor, the people in poverty are often women. According to the Pew Research Center, half of families in poverty are women-led, with a woman as the head of household. You also see that women often work in jobs that require that they have assistance, so they have less career stability and less, lower salaries associated with that work. They often find that, because women may be out of the workforce caring for children, or they might be in these lower income jobs, they're also not building up their Social Security. So now that poverty becomes a lifetime issue because it's affecting them not just in their working years, but in their elder years as well. And then they also may not be building up any kind of pension, or when they're out of work, they don't have any kind of income to help sustain them, or for whatever reason, if they lose their job, they likely can't build up savings or have other benefits and resources that can help take care of them. So there is a gender wealth gap where we see men hold a significant degree of the wealth in this country. But wealth gap in general, when we look at the disparities between different groups of individuals, the haves and the have-nots, and what we see in terms of wealth overall, wealth is kind of your net resources, right? It's your assets less your liabilities. So everything that you own less everything that you owe, and the remainder is your wealth. And what we find is that there's a bigger gap between the haves and the have-nots, between the wealthy and the working class. So, even the middle class, we're starting to see a larger gap. When you're able to buy a home, you build wealth because you build equity in your home. When you have a good career, stable career, you're able to build savings, and you're able to build pensions, and you're able to build investments, and all of those things contribute to wealth. The wealth then protects your quality of life, and that should something happen, it now can be a resource you tap into to support that need. It also can help sustain you throughout life and beyond your working years. And it's something, should something happen and you pass away, you can pass on to your children, and then that wealth continues to expand. And that's a challenge because you have the haves who've had this wealth for generations, and they pass it on from generation to generation, and it accrues and grows, similar to our debt, right? Where you have this bill and the interest accumulates, and then the debt and the balance keeps growing and growing. Well, with the wealth gap, that's what happens with wealthy individuals, where their wealth keeps growing and growing, debt keeps growing and growing for impoverished people. And how are we ever going to get ahead? And where we see wealth gaps between specific groups is we see a wealth gap between men and women. We see a wealth gap based on ethnicity, where we see that white individuals have significantly higher wealth than communities of color, particularly our Black community here in the United States. And, we see a wealth gap between educated individuals as well. And sadly, wealth buys you access to education, and for too many people, they don't have the funding to go to college, and so they can't get that education to take them to the next level. So overall, we see this gap widening, and when we try to think about how can we close it off, it becomes very complex and challenging because of that exponential compounding effect. We saw the Great Recession in 2008 with the subprime mortgage crisis just expand the wealth gap. We've also seen the wealth gap expand in, COVID and post-COVID. And, as some are predicting an economic recession here in the early 2020s, and that might also be another mechanism by which we see this wealth gap growing. But it has become incredibly problematic. You've seen more attention drawn to it after 2008. We actually had the Wall Street, the occupation of Wall Street, and sadly that just didn't come together for any long-term sustainable way to break through and break often this corporate hold on wealth. And I want to draw your attention to the last bullet point. Women of color had the highest foreclosure rates of any group during the recession. So there is evidence to suggest that the banks were targeting people of color, but in particular, women of color suffered the most. And it's important to note that when you're talking about a lot of just disadvantages and challenges and barriers in life, women of color are often the ones paying a huge price. So as I mentioned, there is in fact a racial wealth gap where you have Black Americans being 3 times more likely to live in poverty than white Americans. You have them facing higher unemployment rates, higher foreclosure rates during the 2008 recession because they were specifically targeted. So although we have quote-unquote civil rights and we don't have enslaved individuals anymore, there's other ways that we continue to bind communities of color through our economic policies and our social systems and the barriers that they continue to face. How can we counter this? Well, we can certainly maintain an appropriate both federal and state minimum wage that creates a livable wage where people can sustain themselves. We can also try to make sure we're eliminating any wage gaps, be it based on gender, sexuality, or even people of color make less money than for doing the same job with the same qualifications and the same background. They're paid less than their white counterparts. And offering free tuition to everybody who wants to go to maybe community college, maybe other state public colleges. Depending upon the state, some of that might be more affordable in some states than others. The Occupy Wall Street movement, as I mentioned, after the 2008 recession, it really drew attention to the haves and the have-nots, and we saw corporate greed continue, or not continue, well, it is continuing, it's persisting, but we saw corporate greed become kind of an everyday topic of conversation in everyday households. And so there was some raising public dissent about it. And particularly when subprime mortgages were targeting low-income individuals, and the wealthy were profiting off that. And they even benefited from corporate bailouts. And, here you have consistent political efforts to reduce benefits to individuals receiving these social welfare programs, and then, the corporations get bought out even after unscrupulous practices, and that's problematic. And so there was a lot of public dissension about it. There were protests, Unfortunately, this movement really wasn't able to persist toward any substantive change because there wasn't a unified voice. It wasn't a clear, organized effort and movement that could really make meaningful change in Washington, D.C. So in terms of, capitalism, some people think that capitalism is the root of all evil. Certainly, when you put corporate profit above the well-being of, citizens and their everyday needs, like insulin, one has to ask, is it in fact healthy for us to be so grounded in our capitalist values and philosophies? You start to see the middle class shrinking because there is this allegiance to shareholders, and it's profit over people. It's profit over ethics, morality. Sometimes you have these huge astronomical salaries being paid out to corporate executives, and in particular their CEOs, their executive officers, and then they're not paying a livable wage to their employees, or their employees have to work 2 and 3 and 4 jobs, or they don't offer their employees benefits, or they don't want to commit to full-time wages, so they do have to offer them benefits. So you find them using all these loopholes again to profit, to increase the profit margin, and unfortunately it's not serving the needs. There's no longer this idea that you're going to go into a job, have a stable job, they're going to offer you healthy benefits and a pension that's going to be able to support you and your family for the rest of your life. They're constantly shrinking the benefits available to the employees so that they can increase their profits. You see fewer unions, and you see unions having less power than they did in the civil rights era. And unfortunately, that means that we don't have the organization, the structure, and the protections of those unions, and it creates greater opportunity for corporate exploitation of workers. You also start to see some changes in our politics and our economic views, and corporations now have more political power. They actually are huge campaign contributors. You see a lot of legislators who don't want to upset corporate America, and they often sell out their everyday American citizens, which is a problem. They also get huge tax benefits and subsidies, and we're far more gracious in what we're willing to give corporations than our own private citizens. And the job opportunities are often being sold away to other countries because they can pay individuals lower wages. I have a friend in Mexico, and she's talking about the Nissan plant that's building cars in Mexico now, and it's having negative environmental effects on the local community, but they're also exploiting the workers. And it, again, all goes back to how can I maximize profits, and even if it's to the detriment and maybe destruction to the workers and the communities. So when we talk about human services and poverty, as you go into human services career, those two things are interconnected, right? Where a lot of the programs or the problems that we're dealing with can be connected back to poverty and lack of resources for individuals who are coming from impoverished areas. And so it's really important you, as a prospective worker in human services and social work, examine your own biases about people living in poverty. It kind of helps when you may have your own experiences navigating these programs, because it might offer a lens of understanding and compassion. But if you do not have that lived experience, I recommend that you spend some time actually working within communities that have economic strife, that are struggling, so you can see how difficult and challenging it is and maybe gain some insight. We have a prejudice overall in our country and in the development of our human services programs. And we can see that by the kind of sticks that we have, and where we basically have rigid eligibility criteria, and then we also kind of have punitive controlling measures when we are trying to give people these benefits. So we might have curfews involved if we have, any kind of, housing, group housing that they need to access. But we mentally have imposed the stigma upon individuals living in poverty. We've judged their character, and we limit their resources and access to these resources based on those biases, those judgments. When we go through the history of social welfare programs, the first welfare programs were modeled after England, and there were kind of three categories of needy vagrants, involuntarily unemployed individuals, and then the helpless. And so they grouped these individuals, and the types of resources and the attitudes towards supporting those individuals varied based upon kind of what they were attributing the cause of their poverty to. And we also had to raise taxes in order to support these programs and sustain these programs. And then almshouses were created, which were effectively poorhouses. And nowadays you might see those translated into like projects in Philadelphia or New York, where we pack people into kind of mass housing situations, and theoretically it's supposed to make sure that they can be cared for in a more efficient way, but it also gives us an opportunity to neglect larger groups of people. But the almshouses were created for needy individuals, including aging and older adults who needed caretaking support, individuals with varying abilities who also needed caretaking support, homeless children, like orphanages, right, where someone needed to care for the children. And, the quality of care available varied, but ultimately, quite often, the residents in these homes were neglected. And so we saw a cultural shift where we saw this kind of institutionalization approach shut down, and we wanted more community-based resources, where now you don't see these poorhouses, but you see food banks where they can go and gain access to food. Or you might see clothing donations or housing assistance. Dorothea Dix is one of our prominent historical figures in human services in the field of social work overall, and her work primarily started visiting jails. She used to teach Sunday school in the jails, and after visiting hundreds and hundreds of jails and prisons, she saw the disparate treatment, and she determined it was unhealthy, and she committed her life to campaigning and lobbying for prison reform, where they should be treated with dignity and respect. And it eventually helped so that people who couldn't pay their debts were at one time thrown in jail. So she worked to make sure that didn't happen, because we were effectively criminalizing poverty, right? She also was ending cruel punishments, that would violate their civil liberties, and was trying to focus more on a rehabilitation approach rather than a punitive approach to our judicial and criminal justice system. Jane Addams is another figure here who was one of our pioneers. She was a sociologist, and we talked about her in a previous chapter with the Hull House and the settlement house movement that she inspired. We also see Dorothy Day